Thank you very much for that, Carol. So that's the weather for most of the UK. We can give you the picture from Coventry today, if you've just switched on. We're live at Coventry Hospital. We've got lovely drone pictures showing you the vast expanse of this place. 8,000 staff. That gives you an idea of how many people work here, and then you get an idea of how many people come here every day. Well over 1,000 beds, 26 operating theatres, and we're talking about all sorts today, including, you might remember from back in last December, when Maggie Keenan was the very first person in the world to get a COVID jab, and that took place 3 floors below us here on the first floor of this hospital. And delighted to say, as well as all the other things we've been looking at today, we've been live in a vaccination centre, we've been on the orthopaedic ward. We have 2 of our breakfast favourites with us on a very windy roof. Apologies to the pair of you for not giving you the right sort of coverage today, but you're in our lovely fake grass chairs. We've got Professor Linda Bauld, of course, and Dr. Chris Smith, who are often here answering viewers' questions. And thank you for all those of you who've sent those in this morning. We'll try and get through some of those today, but also some of the big topics, which we'll also be speaking to the Health Secretary, Matt Hancock, about at 8:30 this morning. Chris, let's come to you first of all. This issue of booster jabs. We've spoken to the professor down in the vaccination centre about the work they're doing at the moment. Where are we on where we might be with a booster programme? Who will be responsible for that? The rollout, when we'll know about it? Because I'm sure many of our viewers will be thinking, OK, maybe I've had 1 jab. I'm looking forward to my first jab. Maybe I've had 2. What happens next?
Well, what we anticipate is that we probably will need to boost people's immunity, because as far as we can tell, immunity to coronaviruses as a group of viruses is not long-lived. In other words, in some people it might be, but in the majority of people you probably become susceptible again. Broadly, the people who are most at risk from flu are most at risk from coronavirus infection, so it makes sense to use all that learning and to do this. And we do have some idea as to who's probably going to be prioritised for those sorts of booster jabs. Probably the people who are at the top of the JCVI list,
that
and
same
probably
list we saw
that's right,
first time
and
round.
Probably the people who were vaccinated first, who were at the top of that list, because the most time will have elapsed by autumn by the time we want to give those boosters. So probably we're looking at an autumn rollout.
We've talked, haven't we, Linda, on many occasions about learning to live with this virus. And I suppose this is part of some of those next steps, but that doesn't underestimate the huge scale of the job this is going to continue to be.
It is, and also there is a really important trial, the ComBoost trial, which started recruiting patients recently and will report in September. And what they're doing is they're looking at people who've had both doses 70 days after the second dose, and then giving them a 3rd dose of different types of the vaccine. So we do expect results from that to inform that programme, but the scale of it is huge. The NHS has had to step up to deliver millions of doses, and we're going to need to keep doing that for the foreseeable future. So I think we shouldn't underestimate the effort, but recognise that the uptake's been so good, we hope that will happen from boosters as well.
Lots of other questions this morning from our viewers around about what Dr. Susan Hopkins from Public Health England was saying about the number of people who need to be vaccinated before society can open up. And
we don't know, because at the moment these numbers are predictions based on mathematical models of how diseases spread. We know that with some infections you need to vaccinate a very high fraction of the population to stop them spreading, and this is called herd immunity. It's where that term comes from. The effect is that you've got a person who's susceptible and a person who's got the infection, and the more people there are who can't catch the infection, the greater the distance between those 2 individuals effectively is. It might be that you can get down to 50 or 60%. We think that for this coronavirus it's going to be somewhere between the 2. So 75% seems like a reasonable estimate. The slight fly in the ointment here, of course, is that assumes everybody broadly across the full spectrum of age is immune, or 75% of them are. In the country at the moment, remember, we've prioritised by age for the vaccination. So there are lots of young people who are still waiting to be vaccinated. So there's currently a sort of corridor through society, which is young people who are currently susceptible.
Important point to make, isn't it? Many people will be watching this morning thinking, OK, when do we open up? What figure do we hit before we open up? But as Dr. Chris was saying there, Linda, it's really important that it's not just a simple equation. And
we need to look internationally and see how other countries are doing and how many people are vaccinated. But I think it's a gradual process. There's no doubt that the vaccines are going to have an impact, not just on the reducing the number of people in hospital. You've been speaking to colleagues here, but also the vaccines eventually will prevent transmission more than they currently are. Because if we have more people vaccinated, that means that the virus has less places to travel, you're not as many places to go. So you've lost one of our questions now.
That's some of your questions coming in from viewers, so I better pick those up. Let's get to some of those actually, because this is from Mark, who sent this in on social media. Mark says the virus could mutate again before July the 19th, and then again and again. We talked a lot about mutations, haven't we, and various variants. Is that something we have to factor in when it comes to living with coronavirus?
I think we focus on the reality. The reality is this coronavirus is not going away, at least not anytime soon. It's something we therefore have to live with rather than say we can get rid of. With that in mind, we have to have a strategy for, well, how are we going to live with it? We anticipate that it will behave a bit like the flu, probably be seasonal, so it'll peak in winter and drop down in the summertime. We know who the vulnerable people are. We know how we can stop it at the moment with vaccines, and we know that it changes in the same way flu changes. What do we do about the flu? Well, we do surveillance, we look where it's going, we look how it's changing, and we update vaccines accordingly.
OK. I just say, if you just switched on, we're approaching 8 o'clock, you might be thinking, what on earth's happening to BBC Breakfast? There's lots of issues. We've got the Health Secretary coming up later on. This was the hospital where the first COVID vaccination in the world was handed out back in December. And we're currently speaking to Dr. Chris Smith and Professor Linda Bauld, who you think will know about that. If, when, how it will happen? Will it be for summer holidays, if they happen at all?
So we're waiting for guidance from the Joint Committee on Vaccination and Immunisation. We've already seen the Pfizer vaccine deliver its results, a trial of over 2,000 young people, 12 to 15-year-olds. So we should know very soon. The US has already given first doses to millions of teenagers, Canada, Algeria, Israel, etc. There are different arguments, pro and cons, to doing it, but I think the key thing is if that is advised, we know from the trial that it's safe and effective for teenagers. And I think by doing that, it would add to population immunity, and also, given, the self-isolation from school, if they come into contact with somebody who's positive, vaccines for teenagers could also help with that. But let's wait to see what the decision is.
And touching on that, again, something which quite a few of those questions are looking at is that issue of isolation. The Health Secretary might have something to say about this later on.
Because, as we look ahead, we have to move away from a model of requiring that isolation for everyone who comes into contact with a positive case. We know there's a study underway, and that's important, but we also know that the US is already, the USA, giving guidance that if you had both doses and a week or 10 days after that, you don't have to isolate. So again, we need to wait to see, but and this is a personal view, we are moving in that direction, and we just need to give good information to people if that is what's advised.
Because the plan would be, in place of that 10-day isolation, it would be, we understand, something like a daily test, Chris, to try and make sure that there's still, those people are being looked at and checked. But
the way you do that is you have an open mind about what might work. You do various studies, you gather data, and then you say, well, this strategy looks like it's a good compromise between practicability, safety, and not having a massive dramatic impact on people's lives, because at the moment everything we're doing, especially lockdowns, has an enormous impact on everyone's life, on education, on their mental health as much as anything else, and that's a very high price to pay. If we can do it without that huge impact and stay equally safe, that's a much better solution.
Delta variant is 60% more transmissible. How do we know this is down to the variant itself and not the fact that we are now mixing more, as there are fewer restrictions than there were back in January?
Okay, the best way to think about this is that we originally had the Kent variant, B117, and this has been replaced,
now, we?
or the alpha form, or whatever it is. I mean, they're so complicated, all these names. I'm going to go with the old way of naming it, because I know where I stand. We know that was causing the vast majority of the cases in this country. When the Delta agent, the Indian subtype 2 variant, came into the country, it has displaced or replaced the Kent variant as the cause of most of our cases. If we look across the board now, we're reading the genetic codes of almost all of the cases we're diagnosing in the country now, and it's accounting for well into the 90s% cases. Now, in order to do that, it must have some kind of advantage over what was already spreading. If it was just our behaviour that was accounting for the increase in cases, you wouldn't see one virus strain replacing the other. The fact that the Indian subtype 2 or Delta variant has replaced the indigenous form we had here to start with argues it's more infectious, more transmissible, and has therefore begun to account for the vast majority of the cases.
Throw some very complicated stuff at you sometimes, but you're answering it so well. Professor Abdul says, what is the recommended length of period between having the second dose of the vaccine and then possibly a booster dose? And can I the 19th of July, they're over 40.
Sure. So for Abdul's question first, we don't know yet what the duration after your second dose would be for a booster. But as I have said, the COMBOOST study will tell us about that as well. So as I say, the people in that study have to be 70 days post-second dose. Also, in terms of waning immunity, we know that at least 6 months protection after that second dose from what we see, but the people in the original trials, they're only around 9 months second dose now, post-second dose, so we'll know more. But again, I think boosters probably likely, as Chris says, in the autumn, just for the most vulnerable group, but we're not delivering them at the moment, so let's wait to see. In terms of appointments, the really key point there is, irrespective of the July date, if you are given an appointment that is longer than 8 weeks after your second dose, if you're 40 or above, go into the system. It depends where you are in the UK, but each devolved nation you can do this, and rebook to try and get an earlier date that takes you closer to that 8 weeks after your second dose date.
Okay, thank you very much this morning. Are those chairs comfy, by the way? They look a bit strange.
They're a little bit bristly. You know, I'm thinking maybe not in the garden.
Okay.
You wouldn't have to cut the grass.
Well, thank you for being. I know we've made you sit on all sorts of things over the last few months. It's always a pleasure to talk to you both. And thank you for answering so many of those viewers' questions as well.
All the best.
Thanks for joining us at Coventry Hospital. We're here live until 9:15 this morning. We've got the headlines coming your way in a moment on BBC Breakfast.
Hemingway was a writer.
The 29th of June on BBC4 and iPlayer.
I am a hugger.
More than just the headlines.
Very good morning to you. Welcome to Breakfast with Louise, Minchin and Dan Walker. Our headlines today.
So as the race to vaccinate the whole of the UK continues, we're live at Coventry Hospital for you this morning. Rather windy up here on the roof, but this was the place, the first vaccine for COVID-19 anywhere in the world. And remember, this was meant to be the day, wasn't it, the 21st of June, that should have been Freedom Day until those restrictions were extended another 4 weeks. We'll be speaking live to the Health Secretary, Matt Hancock, on this programme at 8:30.
Good morning. It's Monday, the 21st of June. Our main story, senior health leaders have warned the government that it must start planning now for COVID booster jabs.
Update just after 9.